Good evening, ladies and gentlemen. Thank you for joining Ackerman Alignment at the OSC Centre. The OSC Centre is the Ozone Stem Cell. The Ozone Stem Cell Centre. You know, I've been talking a lot about ozone stem cell redox technique. You know, something that I haven't shared with you is basically what it does. Yeah, ozone stem cell technique has the ability to reanimate dead tissue. Now that's a really important concept for you to take in and to consider, because if it's true, it means that there is great success for either yourself, who may be a sufferer of pain, chronic pain or acute pain, or it may be good information for someone that you know and whom you can help by referring your friend or your family member to our centre here at the Ackerman Alignment OSC Centre. So you've heard me speak a little bit about stem cells. You've heard me speak how stem cells are the infant cells. They are the precursors to mature cells. So if it's an immune cell or a red blood cell or a tissue cell, stem cell technology has the ability to be able to rejuvenate and regenerate either dead tissue or damaged, injured tissue, inflamed tissue. So what would be a dead tissue? How would I classify a dead tissue? Well, a dead tissue is something that still has nerve stimuli. However, the tissue has no circulatory corpuscles functioning inside the tissue. Yeah. So basically, you know, we have a minuscule of many millions and millions of blood capillaries that flow throughout the body, and those blood capillaries also have access into the myofibrils and the tissues. Now, you've heard me speak about myofascial trigger point therapy, and you've heard me, I don't know, maybe you've done some research in relation to myofascial trigger point work, and you have come away with the function or the preconceived idea that myofascial trigger point therapy work is strictly massage. Okay? It's not. Myofascial trigger point and myofascial release is far more superior and complex than you could ever imagine. I'm a practitioner with over 27 years of research in this field. I have studied with some of the most eminent professors and surgeons, orthopedic surgeons around the world. I have trained under orthopedic surgeon Paul Ackerman from Stockholm, Sweden. I did my master's in chiropractic medicine through the Stockholm Clinic. and the Karolinska Institute, of where Dr. Paul Ackerman is the Associate Professor. I myself am the founder of the Academy of Functional Medicine and Integrative Therapies, and it is in that academy that we specialise in teaching tactile therapies, sports remedial therapies, sports orthopedic therapies, osteopathy, chiropractic, herbal medicine, nutrition, iridology, live blood analysis, many, many years of research and many thousands of miles travelled to gain the type of education and knowledge and scientific evidence to back up what I do. So I don't want to purport on what someone else is doing, because I believe that tonight is going to be an interesting discussion. We're going to be talking about the cervical, the skeletal system in relation to our health, physically, spiritually, and mentally. Because that's what the human genome is made of, those three elements. Yeah, I'll say them again: physical, spiritual, and emotional. Okay? Psychological. Physical, psychological, and spiritual. They're the three elements that makes up the human genome. I'm really excited about stem cell technology. I'm really excited about stem cell technology. Reanimating dead tissue, injured tissue. Yeah. That's a powerful concept. You need to understand that the spiritual element is part of that quota. Okay. I don't want to philosophize too much about it, but you just need to understand that, you know, the technique and the knowledge, you could really put it down to a supernatural event. It sounds spooky, doesn't it? But we don't want to get spooky. We don't want to be spooky about something that involves your health and involves the opportunity for you to recover from an inflammatory condition. Yeah? All right, so let's talk about the cervical. Let's talk about the cervical, the skeletal system. Okay, so you can see in my hand a vertebral column, and the vertebral column has a variety of processes, and it's this column that has diverse flexibility, so it's able to pivot, it's able to bend, it's able to do many things that make you do what you do. Okay? So when you go running, it's obvious that this specimen, that this model here provides you the flexibility to be able to go running, or to do stretching, or to do yoga, or to go swimming, or to kick the ball. But the interesting thing is the head. Now, this is just a model. This is just a prop that I'm going to use to explain to you what the head does. So the head, 44 pounds of weight. Wow. Do you understand that? Do you understand the significance of the amount of weight that your spine carries just with the head? That's 44 pounds. 44 pounds which must rotate, it must flex laterally, yes, anteriorly and posteriorly, and of course it has the ability to also tilt, okay, tilt. So that's the head, and the head sits on what we call the atlas. Now this model does not show an atlas, but it's still giving you an idea of what the atlas is. And it's the atlas. Let me explain. Okay. So the atlas is the vertebra that sits like that. Of course, it's much bigger than that. This is just a model. And so it's this bone, it's this vertebra that the head must float on. That's right. Your head floats on this vertebra. So it's really essential. It's really essential that the floater, the atlas, is in perfect functioning order. Let's just talk a little bit about the anatomical movements that the atlas does, and talk about the nerve tissue that feeds from the atlas. So what does the atlas nerve feed into? Now you must remember that each of these nerves have a foramen. They have a canal, an opening. And so if that opening or that canal in any way, shape or form is obstructing that nerve, well then you're going to have difficulties with the biological function of what that nerve provides. So what does this nerve provide? The nerve actually feeds blood supply to the head and the pituitary gland. The pituitary gland, wow. You know what the pituitary gland does, don't you? The pituitary gland is what changes and monitors the sensory nervous system. Okay? So it's light and dark. So the pituitary gland, it sets contrast of light and darkness and how we observe light and darkness. So that's a little bit about the pituitary gland. And the pituitary gland also produces many other different functions in the body. It's related to the growth of hair and our nails and our skin. And also the atlas nerve feeds into the inner and the middle eustachian tubes. The eustachian tubes are the canal to where we have audible sounds recognized. So it's also the sympathetic nervous system. Sympathetic nervous system. So that's the motor system, the motor sensory system. All of these nerves are motor sensory function. Okay? So that's a little bit about the atlas. Now, what would be some of the effects? What would be some of the symptoms that you would have if, for some reason, the atlas just tended to become subluxated? Yeah? To become subluxated means to shift from its normality, to shift from its concentric position, organic position. So what would be the symptoms? Headaches is a common one. Yeah, headaches. It can be either frontal or it can be at the rear. All right. Nervousness. You feel nervous. You know, you have the twitching. That's what nervousness is. Nervousness also means that you have fear. You know, we shouldn't fear anything. Yeah. Because remember, OSC is supernatural. So never fear the supernatural. So also another symptom is insomnia. Insomnia. That means where you're not able to sleep. You're going to sleep at very late hours of the day, the night. You finally get to sleep about 3 o'clock in the morning, when really you should be asleep at 9 o'clock. Because remember, our sleep cycles has a very special cycle that when we reach 1 o'clock, that's 1 a.m. in the morning, that is when the body is at its most reparative stage, restorative stage from the function that has been before. Going back to looking at insomnia, head colds, high blood pressure is also a condition. Nervous breakdowns is also a problem. Okay. You know what a breakdown is? A breakdown is when your body's had enough and you can't cope. Your nervous system can't cope anymore. So these are all the conditions of the atlas system. All right. Also, amnesia. Amnesia. Now that's an interesting concept. Amnesia is not knowing where you are. Have you ever had that problem? Have you ever been confused? Okay. Confusion, amnesia, forgetting people's names, maybe forgetting people's faces. You recognize them, but you forget their name, or maybe you're a little bit forgetful in regards to, well, this is amnesia. This is all related to the atlas, because that's what we're talking about. Another one would be also chronic tiredness. Chronic tiredness. Now, you've heard me speak about the medical terminology of chronic and acute. Chronic means long-standing. Acute means a short period of time, highly inflamed. Chronic is inflamed as well, but it's a longer period of suffering, you know, that it's just been on, it's been going on and on and on and on and on and on. Okay. There's been no period of there's been no cessation in your suffering. Another one would be dizziness. Okay, so when you're laying supine or prone and you rise quickly and you feel dizzy, well, that is related to the atlas. All right, so tomorrow I'm going to come back and I'm going to be talking about the axis. I'm going to come back tomorrow and we're going to be speaking about the axis. So this is Dr. Jeffrey Hunter. Thank you for joining me, and hopefully we'll see you again tomorrow. Okay, ciao. Oh, hit the subscribe button. Yeah, hit the subscribe button, and so you can, and also make sure that you click the bell so that when I go live, you'll be able to watch again. All right. All right. Ciao now. Good night. Cheers.